As I said, welcome to the live recording of the Talking About Kids podcast, done once a month in cooperation with the Arizona Alliance for Adolescent Health. The topic today is how a healthy democracy can support healthy families. And my guest today to help us explain and explore this issue is Sandra Gutierrez. And Sandra is the West Coast Deputy Field Director for Vot-ER. Vot-ER is a nonpartisan, nonprofit organization that's working to integrate civic engagement into healthcare. They are committed to, and I quote, healthy communities powered by inclusive democracy. And I'm going to let Sandra explain what all that means here in just a moment. But to begin with, Sandra, first of all, thank you. Welcome to the podcast. And can you tell us all a little bit about what got you interested in healthcare and civic engagement?
Yeah, absolutely. And hello, Brad. Hello, everyone listening in. Thank you so much for having me here and giving me the opportunity to talk about the wonderful work that Vot-ER is doing. Um, on a personal level, I come more from the civic engagement background. I have a history of working on a different level and ranges of campaigns. I'm not originally from Arizona. And when I moved here about 8 years ago, I actually was working at our local courts. I was working in the city public defender's office and then eventually in the county court as a clerk. And then COVID happened. So, as a mom, healthcare became front and center of my life. I have now an 8-year-old son who has asthma. And
Mm,
so during COVID, there was a big shift in our family, in our care, and just evaluating our lifestyles. So unfortunately, I had to leave my job at the courts to focus on my son and his health care. And while I love what I do at Vot-ER, I don't think that people should have to change their careers or their lives because of health concerns.
mm,
So that's really, why my life has been recently kind of merging the two. Vot-ER really allows me and gives me a space for me to advocate for healthy communities and democracies. Also, on a personal level, just being a mom, you worry about what is happening around you. And I I think that regardless of where you stand on certain issues, as parents, we all have concerns about the well-being of our children.
mhm,
For me, that recently has become centered around gun violence prevention,
mm.
with guns being the number one killer of kids. I think it's really important to talk about how we can protect our kids, how we can keep them safe. So this isn't my work with Vot-ER, but it's more my civic engagement, my volunteer, my community activism. I really enjoy speaking to the Arizona population communities and offering free gun locks, normalizing conversations around health, and making sure our kids are safe, right? So one of the things that we talk about is asking if there are guns in the home and if they're safely secured. Think about it like if you have a child with a peanut allergy and they're going to go spend the night at their friend's house, you want to let the parent know of this deadly allergy, right? Same thing with just normalizing, is there a gun in the home? Is it secure? And putting that responsibility on the parents to protect children. So um, there's, I think, a lot of introspection in the work.
Mm.
Um, but with Vot-ER, I appreciate that this is all done on a nonpartisan level. We're engaging with these communities, with healthcare professionals and patients, not necessarily asking them, what are their health concerns, but really just encouraging them to be part of the voting and civic engagement process.
Yeah, and I want to come back to that because I think that, as we talked about, Sandra, I really want the listeners to hear your story from two sides. One, from the perspective of what exactly Vote-ER does, not just in Arizona, but obviously
Mhm.
nationwide. And I want them to be also thinking about how this might apply not just to their own healthcare, which is what Vote-ER is about, but how they can apply the principles of Vot-ER to issues that are important in their own work and that might not be one of Vot-ER's issues. And, you just brought one up, but could you give the listeners just a little bit of a background about Vot-ER and what it does?
Absolutely. So, Vot-ER was originally started by an ER doctor, Dr. Alistair Martin, and he noticed that there's only so much he can do for a patient within the healthcare space. For
Right,
example, like with asthma, he can provide medication, um, but he can't necessarily impact the air quality or the health, the air quality of the community, right? So it was really about educating patients on the importance of voting and explaining that the majority of your social determinants of health, 80% happen outside of hospitals and clinics.
right.
Again, air quality, um, childhood education, employment, water access, food access, all of these things happen outside. So he really wanted to just let patients know that while he can help them, they can actually advocate for themselves on a much larger scale by just being engaged in the voting process. And what we often see is that the communities affected by these disparities are less likely to vote.
Mm,
So there's evidence that shows on a global, national, state, and local level that when communities vote at higher rates, politicians are more invested in them.
mm.
So they have, better healthcare access and things like that.
That's interesting, and that answers one of my questions I was about to ask because in my knowledge of Vote-ER, I don't see them putting out like a ballot, a sample ballot. So I know other issue advocacy groups that when they are recruiting or trying to get out the vote, they're also accompanying their efforts with, and these are the issues that you should vote on, and here is how you should vote, and here are the candidates you should vote for. So that's a model I've seen, but that's not Vote-ER's model, is it?
Absolutely not. No, we are strictly nonpartisan. And
Okay.
the idea here is that your doctor is a trusted person. Um, it might be the case that you're never really asked about your health and your well-being and how you're doing until you're in your doctor's office, right? And so, even from a legal standpoint, we're not
Mm.
allowed to tell people how to vote. It's really just having voting registration be easily accessible to them is what we're doing. So our doctors use badges, just just like they do with their medical ID cards or on their lanyard. Our badge has a QR code, and they snap a picture. The patient then goes on their phone and they register to vote. They have the option to view what's on their ballot, but again, all in a nonpartisan way. The idea here, again, being that we've noticed when communities turn out to vote at larger rates, their overall health is better. It's not really about telling people who to vote for. It's about just giving them the access and the opportunity to be involved in the process.
Well, there's so much about that that I love, and I'm mentally mapping it against what I know from kind of a larger literature on human behavior and social psychology. So, am I inferring that correctly? That just by the fact that they are being asked by their kind of healthcare community to vote, not being told what to vote, not being told who to vote for, but by the fact that they are being asked by their healthcare community. Is there the assumption then that when they go to vote, they will be thinking about healthcare issues? They'll be thinking about how these policies and how these politicians think about them and their family's healthcare.
Absolutely. That is the idea here. Just like, again, if you have an allergy or you need certain medication, doctor is really trying to help you understand that policy is playing a role in these decisions and that you should engage in the outcome of those. Look, these things happen either
Mm,
way, right? Policy is going on, and I often you hear people say, I don't do politics, but we know that politics affects you. It does you, right? Um, so yes, that is exactly the idea. Is that when there often are doctors or providers um, ask about voting history
hmm.
during social health history, like do you drink, do you smoke, are you safe at home, are you
Right.
registered to vote, because all of those things impact your health. um, Especially I think when we're talking about adolescents and children and the way that we've seen like them having um, a need for more mental health access or support, things like that. The idea is that your doctor is not just improving or having a discussion about your quality of life, but your families as well, your community, your neighbors.
Right. Well, and then just going back to the very first, one of the very first things that you said, that you know that politicians pay more attention to people that vote. And so I suspect also that that is something that Vot-ER as an organization reminds politicians about who you helped register, how many people you helped register. Is that part of your strategy as well?
Not politicians per se,
Okay.
but we do. We have partnered with like the Human and Health Services Department, and it's really so that they can advise community health centers
Mm,
on legal ways to do this type of work. It's not necessarily to have a voice in a partisan way or appealing to a certain candidate. It's really just about getting the overall message out. Just
right.
yeah.
So I've heard that one of the ways that you are in getting, your population more civic engaged is that uh, at clinics, that when they're being assessed for social determinants of health, you're also asking about whether or not they voted. What other sort of techniques does Vot-ER use to increase civic engagement?
Yeah, so I mentioned our badges. We also offer free posters and things that hospitals or clinics could kind of print in the waiting room, give the patient a chance to like look over and think about maybe then that way it's already on their mind by the time that they talk to their doctor. Something that is really, really new with Vot-ER and we are so excited about is we have recently partnered with Epic and they, um, when you go in and you fill out your questionnaire for your healthcare and your history and all that, they have actually integrated for any hospital or healthcare setting environment that uses Epic. They have integrated a question in there now so that the patient can answer if they're registered to vote,
Mm,
and then the doctor will see that before they actually have the conversation. So that's something brand new that we're rolling out. And we also have the opportunity to um, include that registration option in the discharge paperwork. So again, if the patient, might not be able to do it at the time, then they can take that back with them and still have the opportunity to register. So that's what we do primarily in a healthcare setting. But we have several programs as well. Um, we have a 9 month training program, our
Right.
fellowship program for professionals in the healthcare space to learn organizing skills. And, this really is about, again, trying to reach out to these communities that are affected with these disparities. So it's really um, beneficial for people who already understand, or for not, for health professionals who already understand this problem and want to have a holistic approach and center these
Mhm.
issues for these patients. We also have a Healthy Democracy campaign, which is a nationwide competition of medical students where they compete to see who can engage the most students and the most voter registration on their campus. They get a golden ballot box at
Mm.
the end, a little trophy, but then they also get a letter of recommendation from our founder. So great incentive for any medical students that want to increase registration on their campus. Um, One of my favorite programs that we do, I mean, they're all wonderful, but I love our community civic engagement program. This is a grant program for federally qualified health centers where we actually, I want to say, like, hold their hand, but we train them through the process. We provide free supplies and resources, and we assist with their, voter registration drive, text banks, different ways that they're actually, these healthcare centers are directly doing outreach to their patients.
Mm.
So I say it's one of my favorites because of the populations that they focus on and that they serve. It's,
Right.
those populations that, again, are affected by these health disparities. So, um, lots of ways to get involved and plug in.
No, and I love all of those. I especially like, engaging communities that are, impacted by these disparities that are on the less resourced side of all of these social determinants of health. I have a question that I ask a lot of my guests, and it is one of my favorite questions, but I also recognize it's one of the harder questions that I ask. But I do feel like I owe it to my listeners to ask whether or not what you're doing is working and how you know.
Well, I will say that we started in 2020. We implemented, kiosks and tablets in ER rooms, and then COVID happened.
Mm,
So that kind of all went out the window. But to see how we've pivoted to, the individual badges, and to see how we've grown as an organization has really been a testament to the work that we're doing.
mhm.
We have over 700 hospitals and clinics that are engaged in our work on a nationwide level, including 50 healthcare professionals. We also see data that shows that when an individual is registered by their healthcare provider, they are 11% more likely to come out and vote.
Mm,
So I should mention also that our badges are trackable. So you can actually see the impact that you're making at your healthcare center, at your hospital. You can see you don't get any, private information, but you get a number saying you've registered these many patients. And so we can see um, when certain centers might be more engaged in one of our programs, their registration rates are higher, and with things like that we also see a huge impact with first time voters, young voters, voters of color. And again, the idea here being that people trust their doctors and their
right.
healthcare providers.
At the risk of editorializing here for just a moment, um, I know enough about related bodies of research here to have a prediction, and I'm going to have to go find the answer to this when I'm done, but I'm willing to bet that I'm right on this, and I'm willing to bet that there is a dose response such that the more organizations that interact with a voter that is familiar to the voter and that the voter is familiar with. So a doctor asks you to vote. And then if a teacher asks you to vote, then if somebody that is running or working in their child's after school program asks them to vote, I'm willing to bet real currency that each one of those additional people from their network that's asking them to vote increases their likelihood to vote even more. I mention that because I don't want anybody listening to this thinking, well, since Vot-ER is doing this work, I don't have to ask my parents. I don't have to ask my clients. I don't have to ask my patients. Because I'm willing to bet that each additional person increases the likelihood of that voter showing up just from what we know about. And you can look it up and you can beat me to the answer if you'd like by looking into the social norming research, which is where I think the answer to this is. So for all of my guests who I'm encouraging all of you, all of my listeners, I'm encouraging all of you to get all of your constituents registered and voting. And like Vot-ER, I don't think you even have to tell them how to vote. I think you can just ask them to vote because what they'll do, again, it's in that literature, is that when they are going to the ballot, they'll be thinking about the people who ask them, and they'll be thinking about the issues that are important to those people and to that area of their own lives. So with that in mind, Sandra, do you have any tips for my listeners for how to get their constituents civically engaged? I mean, you've given us a lot of great ideas, and we've learned a lot from what Vot-ER is doing, but anything else you'd like to share?
Yes, vote. And I unfortunately don't have that research and data, and I can bet that you are right on the money that the more we ask, the more that, they are likely to take that step. But I think just modeling that and having that in our community, whether it be our friends, our um, children, I think it's super important that if you have children that they see you voting, whether that be filling out your mail-in ballot, taking them to the polls, really reminding your community surrounding people that surround you, that this is an ongoing process. I know people think about this happening every 4 years or are focused on the presidential election. The reality is that you are much more impacted by policy at a local level. So you definitely want to vote, engage in those conversations. If you are in healthcare, get a badge from us.
Mm,
Um, that's the best thing that you can do is actually just include your patients in that. And we also see that a lot of people who don't vote, I believe it's like 60% of Arizonans are not voting. And when you ask a lot of them, sometimes they say nobody has asked me ever to
right.
register to vote. Um, I was reading your report on um, the Arizona Alliance.
Of
Sorry,
adolescent health. Yes, exactly.
yes, of Adolescent Health. And one of the things that stood out to me was that they said youth value face-to-face voter registration
Yeah.
opportunities. We know that the earlier you ask people to register, the more you ask them, the more likely that they are to do it. If you wait, a week before that registration deadline, oh, they just, they don't care. They, you know, they don't feel that value. Where if you
Yeah.
invest early in them, you keep asking them. So if you're a healthcare professional, order a badge from us. They're completely free. Um, I'm your point of contact. You can always reach out to me, Sandra, Sandra at Vot-ER.org, and that's VOT-ER.org. And another way to plug in is to join our email list. This way you can see what is the best fit for you, how you can engage your communities. Maybe it might not just be a badge. Maybe you actually want to hold a registration drive at your healthcare center, and we can help you do that. So to join our mailing list, you go to vot-er.org/join, JOIN. So, like I said,
And all,
lots and
yeah,
lots of ways.
and all of that information is going to be in the notes on the show. And Sandra, since you are, you know, joining us from Southern Arizona, I would be amiss if I didn't talk a little bit about research of another Southern Arizonan, Dennis Emery, showed exactly what you said, which is that his research has shown that humans are more likely to do things that they're asked to do. It's a great and rich body of research, but it's true. So for all of you, please ask all of your constituents to vote. And Sandra, thank you so much for all of your work and for all of the work that Vot-ER does. For all of my listeners, if you want to participate in one of these or listen to one of these live recordings and participate so your questions can be answered in real time, please go to the website for the Arizona Alliance for Adolescent Health. And Sandra, thank you so much for participating.
Thank you so much, Brad. Great to see you. Bye-bye.